Hello, Dr. Ghalambor here from NorTex Spine and Joint Institute. We're talking today about lumbar, which is the low back, disc herniation. So we have reviewed anatomy on the other videos on the website. As you know, we have the vertebrae, or the bones, and between the bones here we have the shock absorbers. And these are the discs. Now, a normal disc is like a jelly donut. So it will have an annulus, and inside it will have a thick jelly-like material. As long as the jelly is insulated inside the disc, it's happy. It absorbs the shocks a lifetime, so it's pretty good material. The problem will then become if you have little fissures or ruptures of the annulus, and then it would let the jelly to leak out, and that is what we call disc herniation. So a lot of people call it pinch nerve. You know, when the jelly comes out, it pinches the nerves coming out, therefore in the low back causes shooting pain down the leg, which otherwise is called sciatica. In reality, that is a misnomer. The nerves are actually not pinched. This is not a mechanical pinching of the nerve roots that come out. This is more a chemical irritation. And the reason for that is as soon as the disc material is exposed to outside world, it changes of nature, it becomes oxidized, and it becomes something from a happy, beautiful shock absorber to a very angry, inflammatory, irritating, acid-like material that would create a lot of inflammation. So the main problem is not the physical pinching, the main problem is inflammation. A lot of studies have shown that when you get an MRI of people with disc herniation, when they've analyzed the disc, usually a third of that volume that you see is the actual disc material. 2/3 of it is water, inflammatory cells, basically swelling up in that area. So a lot of times just decreasing inflammation either with anti-inflammatory medication, time, or injections of steroids in that area, which is called epidural steroid injection, are enough to decrease inflammation, shrink the size, stop the irritation of the nerve, and then from there on, a lot of times the body can take it from there. They can break down and absorb the herniated disc and partially seal the tear. So that is an overview of disc herniations in the low back or lumbar spine. Thank you so much for watching.